So if you work with patients, clients, people who have pain or injuries or something that needs to be fixed or rehabbed, then I want you to pay attention. I'm working with Rio today. We were actually in conversation, and I had the great idea that we're going to videotape, so we're videotaping this, but it's going to tie in perfectly to the teleseminar series that I want you to sign up for if, in fact, you are a pain relief specialist. So Rio is a therapist here at Diamond Wellness Center, and you were just working with two patients, two clients, who one was in a car accident, and she was just visiting.
Yep.
So she was just sort of a one-off. She was a past client from a long time ago.
Yep.
Then the second client you worked with woke up with a kink in her neck a couple days ago, I guess?
She said this morning.
This morning, okay. So you were able to give her some pain relief. And then you're going to be seeing a third person in a little bit later today who has 4 years of chronic low back problems. So 3 different scenarios, 3 different people coming in, 3 different approaches. Now, one of the things that we were talking about is, okay, so great, you can get them some really good relief right here on the table, but then what? And so trying to figure out, how do you take people from one single session through a therapy plan, and how do you identify how to create these therapy plans? So the lady who was here just on vacation, a past client, she doesn't live here anymore, you can set up a therapy plan, tell her what you think needs to be done, that then she can follow wherever she is.
Yeah.
The second gal who came in with a kink in her neck, she lives here, so there's definitely a therapy plan that you can put together. And then the third person who's coming in later, who we haven't even seen yet, and don't know what his condition is, he lives here as well, so you will be able to put together a therapy plan. So the main thing I was going to ask you, you kind of gave me a rundown of what you said to the woman while she was in here with you about how she can do some self-care. And then, what did you say? Like, what you said, if it doesn't resolve itself in a couple days?
Yeah, just go ahead and come back, and we can do some more focused work on the area itself with her neck kink and her shoulder tightness that she had, and we can get some more focused work on that and modify the self-care that she was doing at that time as well.
Right. So, but you said if it doesn't resolve itself in a few days, is that what you said?
Yeah.
A couple days. So one of the things I wanted to point out to Rio is that that's kind of a wishy-washy therapy plan, and a lot of therapists make the mistake because we don't want to come across as being too pushy. So we sort of put it out there, sort of tentatively, and say, you know, if it doesn't resolve, come back. But as a clinician, as an expert, because you know way more than they know, you need to think about, in your mind, yes or no, should they come back? So that's number one. Yes or no, should they come back?
Yes.
Most of the time, if somebody has a complaint of pain, dysfunction, the answer is going to be yes. Now, the second question I'm going to ask is yes or no, should they come back sooner rather than later? And you may not know the answer to that, but if you don't know, you still want to be able to understand the frequency of when they should come.
Okay.
So there's the frequency, should they come back tomorrow? Should they wait 2 days? Should they wait a week? Each case is going to be different.
Yeah.
Then when they come back, are they coming back just for one single session again? Or do you see that they need to come back for a few more sessions or a series? And then the third, what are they doing in that session? Is it a half-hour session? Is it an hour session? Is it maybe just spot work to one little area? We don't know. But in your mind, you need to be thinking, A, should they come back? If so, when should they come back? How many times should they come back? And for what duration? And for what modality, if you do different modalities. Like for me, I might say they come back for one session of myofascial work and one session of exercises, right? So there's going to be different scenarios, but I really encourage you and other therapists to think in your head, what is the treatment protocol? What is the therapy plan that I want to put in place for this specific client based on this specific client's needs? And even if they're leaving, you still can advise them, and then it's up to them to take your advice and go do wherever they are. And I think it's really a disservice when therapists are hesitant to suggest coming back because they feel like they might be a little too pushy. You don't want to be too pushy, but you need to advise them to the best of your clinical expertise, what you think would be best for them. Now, again, yes or no, should they come back? If the answer is yes, most people can benefit by coming back within 2 days. I know a lot of therapists say a week. But if you wait a week, everything can go back to how it was before. So if you hit it quick and hard, you can usually get better results.
Yeah.
So my blanket, if I'm going to say a blanket statement, would be have them come back in 2 days. And then again in 2 days, right? So if it was Monday, then Wednesday, then Friday, you can get them on the books in your calendar, and you can always say, let me put you in. If everything feels great and there's no other residual pain or restrictions, we'll cancel it.
Yeah.
No big deal, but at least that way I've got you secured in case we need the appointment. So my advice to you, pay attention to who's on your table. Be thinking. You have to be thinking. What is the suggested therapy plan that I want to set up for them? Tell them, and it's up to them to say yes or no. Don't not say it because you're afraid of feeling like you're being too pushy, or that it's going to be too expensive and maybe they can't afford it, or they're really busy and their time won't allow them to come back. You don't know any of their circumstances. Put it out there. Let them know what you think is best, and then let them decide to follow your advice. So thanks, Rio, for letting us film this.
Oh, of course.
It's her iPad. She figured out how to make it work. I really want to invite you, if you like this information, sign up for our Get More Clients, Get More Referrals, Get More Money 5-week teleseminar series that's going to be starting very soon, and you'll see all the information on this page. Thanks so much. Bye-bye.